Now, I want to start with something that's in the opening paragraph of your article. You say, as millions of Americans suddenly lose their jobs in the midst of a pandemic, they may find themselves without health care coverage precisely when they need it most and unable to purchase affordable alternatives from the individual market. This is a really big deal, isn't it?
Yeah, this is really not a good situation for a lot of people. And it's really a pre-existing problem. It's a problem that goes back at least a decade to the Affordable Care Act, but there were problems before the Affordable Care Act as well. From the root of it all is that prices are increasing throughout healthcare, which means that health insurance premiums are increasing. The average employer-sponsored premium for a family was about $5,000 a year 20 years ago. Now it's around $20,000. So that is an order of magnitude larger, and obviously wages haven't kept up with that kind of increase over the past 2 decades.
Your article goes into great depth about the American health insurance system, and we're not going to have a chance to, during the course of this podcast, to get into all of the details. But one of your key points is the problems created by the general system itself of relying on employer-based health insurance. Why is this something that is causing a problem in and of itself?
So I think there are 2 main reasons why it's problematic. One is usually under capitalism or free market, you want the customer to be king. You want the individual who's getting the healthcare to be in charge. This is how we do most markets. When you go get groceries, you pick out your groceries. Your employer doesn't pick out your groceries for you. And when you want a
Thank
car,
God.
you choose what car you want to get. Your employer doesn't pick your car. But for your healthcare, your employer picks your healthcare for you, and it doesn't really work out very great. So, obviously, there are issues with preferences, but part of the real problem why it's become such a big problem in a way that it wasn't maybe 30 years ago is that think of a situation when you're an employer with maybe 100 different staff around a metro area. Well, these staff all live in different neighborhoods. They all have different doctors. They all have different hospitals. And so you end up basically as an employer buying an insurance plan, having to have an insurance plan that covers every single hospital and every single doctor. And that means you have no negotiating power with the hospitals and with the doctors, and especially the hospitals. It's a problem. And so what happens is that when a hospital's costs increase, when it decides to build a new wing, when it decides to spend $10 million on a new piece of equipment, it really doesn't worry about the cost at all because it knows that it's going to be in the network for all the insurers, and it can just pass on the cost to the insurers, and it's only one hospital among many. And so the cost kind of gets lost in the pile, and there's no real constraints on it. And so that is a big problem with the employer-sponsored insurance market. There isn't really the problem with the individual market. With an individual market, I buy an insurance plan. I care that it has my local hospital, maybe 1 or 2 other hospitals, the doctors and specialists that I care about. Whether it has the hospitals and doctors on the other side of the city, I don't really care about it at all. And that sort of empowers the insurer to negotiate a much better deal on my behalf with all these medical providers. And that's where the costs have been coming from. And that's where we need to have some pushback in terms of constraining costs.
Some people might hear what you've just said and say, yes, you're exactly right. The employer-based system is wrong. And that's why we need single-payer healthcare where the government is in charge of everything. You point out in your National Affairs article why that's not the best way to go either.
Yeah, I mean, I think if you think that the root of the problem, as I do with the employer system, is that your individual preferences are bound to the preferences of another 100 employees in your company, well, that kind of dilutes your own control. Well, if your preferences are bound up with another 300 million Americans, you got even less individual control. You're even less in charge of the situation. And to the extent that the healthcare system is not responsive right now, which is a big problem, it's going to be even less responsive if people are pooled with 300 million people instead of with 100.
So if the employer-based system has plenty of problems, single-payer healthcare would create problems of its own, and might even exacerbate some of the problems we see with the employer-based system. we can look at alternatives. You point to some, and you actually say that a couple of countries, Australia and Germany, offer us some good ideas about where we might want to go.
Yeah, so there, healthcare is obviously this is like a sixth of the economy as a whole. So it's this bundle of different industries that have separate different things sort of loosely related to each other. So it's like hospitals and the drug industry and the insurance industry and physicians, and they're all kind of very different, but they're all bundled together. So there are many different aspects to healthcare policy. The thing that I think that is a problem that we created with the Affordable Care Act, which we can learn to fix from other countries, is the fact that the Affordable Care Act, its way of protecting people with pre-existing conditions, was to say that insurance should be priced the same, or had to be priced the same, for people who sign up before they get sick and people who sign up after they get sick. And so what happened as a result of this, we saw pretty clearly in about 5 years ago, was that everyone was healthy. So, okay, well, I can buy insurance after I get sick. I can wait. I don't need to buy insurance. And all the people who had serious medical conditions, had heart disease, cancer, well, they're definitely going to buy insurance the first day it's available because they're going to get a really good deal. And so you end up with this pool of people. The only people who are really buying insurance are either people with these major medical conditions who are super expensive to treat, or people who are getting huge subsidies. And so the average premium, just as of necessity, the basic math of it means that the premium skyrocketed. So what Australia had done, which they'd had a very similar kind of problem. They had a similar set of insurance pricing rules. What they basically said is they said that insurers are allowed to offer a discount to people who sign up before they get sick. Now that has two benefits. Like the first benefit is obviously they're getting a deal that's all of a sudden might be attractive to them, which is nice. It kind of means that they can get insurance coverage. But then also it means that they want to keep hold of that deal. And so it kind of provides an incentive for people to keep the insurance coverage over time, over future years. And so it sort of keeps people attached to coverage and keeps people insured, which helps solve the other problem that we've been talking about, which is this problem of pre-existing condition. The problem with pre-existing conditions is basically people having gaps in insurance coverage who get sick when they have a gap in insurance coverage, and then they have a pre-existing condition when they try and get insurance again. Well, if you find a way to lock people into the market and give them a good reason to stay insured over time, which a continuing coverage discount will provide, then you kind of get rid of this problem of pre-existing conditions from ever coming up in the first place. People were never uninsured, and so they didn't have this issue of a pre-existing condition when they first look for insurance. They're not locked out of the market, they're locked into it.
And you also talked about Germany as another example of something to look at.
Yeah, so Germany actually started with that kind of arrangement where you could get a better deal if you signed up early. But what they did is that they sort of then ran into a problem similar to the one that we had before 2010, which was the pre-existing condition problem. And so what Germany did, instead of saying we're going to change prices for everybody, instead of requiring insurers to overprice coverage for healthy people, what we're just going to do, we're just going to give people subsidies who have pre-existing conditions. We're not going to change anything for people who like things the way they are. The people that like their healthcare plan can actually keep it, and they actually kept the promise in Germany. Like they actually sort of allow people to stay on their plans. They just made sure that the subsidies went to people who truly were uninsurable. So the subsidies went to the people who really needed it, rather than making healthcare expensive for everybody, and then because healthcare is too expensive, throwing subsidies at every insurer to sort of keep them solvent.
Now, in looking at where the United States should go from here, it sounds as if you were saying, don't throw out every element of the Affordable Care Act, as some Republicans had been talking about. And obviously don't go toward single-payer healthcare, which some Democrats are talking about now. What would be the path that we would take from here to where you think we ought to go?
Yeah, so I think the big problem that definitely existed before the Affordable Care Act was the pre-existing condition problem. There were some people who were just uninsurable. And in 2008, Barack Obama had a plan. and Senator McCain had a plan, each of which basically to deal with the situation. So no one really advocated returning to the status quo ante. Everyone was sort of understood that it was a situation that needed to be fixed. We needed to have policy reform to fix it. And even every single Republican replacement plan for the Affordable Care Act had an element that would have dealt with the pre-existing condition problem. And so it was obviously framed as an opposition to Obamacare, but it was never, let's go back to the status quo ante. So the real question is, like, how do we deal with the pre-existing condition problem without destroying the individual market for people who are healthy, without basically getting rid of the value for people who to sign up before they get sick? And that I think is really the right way to think about the problem. It's like, how do you create a market so that there is a good reason, so that there's good value for people to sign up for insurance before they get sick, and then you can provide a safety net for the small amount of people who are just unavoidably uninsurable. And that's actually a fairly small portion of the population. Like, most people, when they develop a major medical condition, it's fairly late on in life. They've had a chance to sort of buy insurance before they get to the point where they have cancer or a heart condition or a stroke.
There's been so much bad news associated with the COVID-19 pandemic. Do you have any faith or belief that perhaps we might see this good news of movement on how we deal with health insurance? Might this be a silver lining from the COVID-19 dark cloud?
Yeah, I mean, I feel like it's almost like there was a lot of pride of ownership wrapped up in the Affordable Care Act. And there were people who staked out a lot of positions, both in favor and against it. And that was 10 years ago, more than 10 years ago now. And we're finally starting to get a little bit past that. We're finally starting to get to a point where other things are happening, where half of the members of Congress probably weren't even in Congress when the Affordable Care Act happened. You can start to have more nuanced conversations. I mean, the Affordable Care Act was 900 pages long. It's perfectly possible to say, I don't like this 300 pages. This 100 pages is good. 400 pages, it's okay. I want to tweak it a little bit. Like, you can have it's not like every single word in the 900-page document is equally bad. And and when you start splitting it up into like the component parts, you can actually sort of realize that you probably agree on like 600 pages of it. And then Democrats would probably admit that they were wrong on like several hundred pages of it as well. And then it turns out that, things that people thought were going to happen didn't happen. And so the actual disagreement is probably less than it was at the time that it was enacted. But you have a lot of people whose pride is invested in the fact that, they went on TV and said it was perfect, or they said they went on TV and said it was the worst thing that ever happened. And that's kind of hard to back down from. But then again, that was 10 years ago. And so just the passage of time makes this sort of thing easier to fix.
In the brief time that we have left, if Congress does nothing, if we keep the system that we have, what will be the long-term problems of inaction?
Well, we're on a glide path for higher cost. That's the core problem. That there's this underlying dynamic where hospitals are competing against each other without paying any attention to cost. And so when hospitals are competing against each other without cost being an issue, because the insurer is going to pick it up, what do? Well, they want to have the best equipment. They want to have the shiniest facilities. They want to have the best doctors. And so you have these bidding wars over every single element that goes into medical care, which drives up costs over time. And not just the expensive facilities, because the cheaper ones have to keep up if they want to have people coming in the door. And so there is this sort of inherent inflationary dynamic to the status quo that's only going to get more and more expensive the longer it goes on.